Okay, this is from the book John Mcdougall, the doctor who fought for you. It's Dr. Mcdougall talking about heart disease. This is part 5. There's going to be 6 parts. Okay, so we just talked in the previous lecture about how surgery, cabbage, coronary artery bypass graft, is close to worthless. Actually, one viewer said you want to eat cabbage rather than get a cabbage. All right, cabbage means coronary artery bypass graft. Okay, so the bottom line was surgery had like no significant benefit for longevity. All right, let me shrink myself a little bit to fit in here. All right, now we're talking about medication therapy. Medication therapy also provides very little benefit. Primary prevention is treatment of patients with no known heart disease. Secondary prevention is treatment of patients that have known heart disease. The benefit of antiplatelet medications and statins is weak. Most patients can get their total cholesterol below 150 with just diet. So this is Dr. Mcdougall talking here. He says, sometimes I prescribe statins in the ones who need help to achieve that. I sometimes prescribe a baby aspirin daily. I encourage them to exercise without causing chest pain. The best treatment for coronary artery disease, and the only treatment that works well, is the low-fat, starch-based vegan diet with no oil, no avocados, and no nuts or seeds. With a high-fat meal, the oxygen in the blood is reduced by about 20%. The high-fat meal caused decreased delivery of oxygen to the tissues, and that has been studied by Roy Swank, MD, PhD, the expert on multiple sclerosis, Peter Quo, the cardiologist from Pennsylvania in the 1950s, Meyer Friedman and Ray Rosenman, they're 2 ophthalmologists who did their work especially in the 1960s. So here's one of these papers. Meyer Friedman, I think Ray Rosenman was on this paper as well, from 1964. Serum lipids and conjunctival circulation after fat ingestion. Okay, and what they showed was when they ate a 67% fat meal with eggs and bacon and milk and butter, they would look at their eye with an 80-fold magnification, and they found they could see little small arterioles occluding from the blood sludge. You know, because the high fat will have positively charged chylomicrons and LDL particles that will overcome the zeta potential and start sticking the red blood cells together. Typical red blood cells got a diameter of about 7 microns. You need to know that. 7 microns, okay? It's a little bigger than a capillary. It's a typical diameter in the ballpark, let's say 5 microns. So it has to deform itself a little bit to pass through that capillary. And if you stick a bunch of red blood cells together, it's going to be harder for them to deform and pass through that capillary. So your pressure is going to have to go up to pump them through those constricted capillaries. Also, the blood becomes thicker, so you're pumping a milkshake. The purpose of blood pressure is to get blood to the top of your cerebral cortex. So you're pumping a milkshake, thick blood, to get it up to your brain, and that's going to make pressure go up. And then the higher pressure goes up, the more you're going to damage the arteries from the hypertension and cause more atherosclerosis, so you get yourself trapped into a vicious cycle. Okay, here's another paper, 1965, effect of unsaturated fats upon lipemia and conjunctival circulation. Okay, where that's coming from is Peter Quo showed that saturated fat was a disaster for blood flow in the 1950s. Ansel Keys also pointed out how sat fat increases LDL cholesterol, increases heart attacks and strokes. And then what Meyer Friedman and Ray Rosenman were showing in the 1960s was there was then this big push to say omega-6 fats were good. And people were saying, oh, get rid of sat fat and just have omega-6 fats. But what Meyer Friedman and Ray Rosenman showed was that omega-6 fats were even just as bad or worse than sat fat. They caused a more prolonged blood sludge effect. And here's more papers. You can look these all up if you want. I looked up all these papers. Effect of unsaturated fats on lipemia and conjunctival circulation. Here's Peter Quo, one of his papers. Effect of lipemia on coronary artery and peripheral arterial circulation in patients with hyperlipemia. That's Peter Quo paper. He did some work in the 1960s. Angina pectoris induced by fat ingestion in the patients with coronary artery disease by Peter Quo. So this one was kind of amusing. He took a bunch of patients with known coronary artery angina, meaning they get chest pain on exertion, and he fed them high-fat meals. And then he checked their blood lipids every 30 minutes. And what he found was the higher their blood lipids, the more likely they would have anginal chest pain. The thick blood was causing them to have cardiac ischemia, less oxygen delivered to the cardiac tissues. Okay, some additional references. Effects of stress management, training, and dietary changes in treating ischemic heart disease. Oh, this is from Dean Ornish's book. The Dr. Dean Ornish Program for Reversing Heart Disease, the only system scientifically proven to reverse heart disease without drugs or surgery at the time it was written. Okay, in 24 days, a 91% mean reduction in the frequency of anginal episodes in patients following this recommendation. In the experimental group, the reported frequency of angina episodes per week decreased from 10.1 to 1.6 after the intervention. That was also published in JAMA. Okay, then there's the Caldwell-Esselstyn book, Prevent and Reverse Heart Disease. He also wrote a big paper along those lines in the Journal of Family Practice, July 2014, A Way to Prevent Coronary Artery Disease. And you can just go to his website, dresselstyn.com. You can just go on YouTube, see lots of videos of him. I made a video recently about Dr. Esselstyn. Okay, reversal of coronary artery disease has been shown by the work of Walter Kempner, MD, back in the 1950s, 60s, and 70s. He showed all these EKGs reverting to normal. Kempner showed many patients who reversed their EKG findings, other patients who reversed congestive heart failure. There's also the work of Nathan Pritikin, as well as doctors David Blankenhorn, Dean Ornish, Caldwell-Esselstyn, Dr. Mcdougall, and they've all shown that coronary artery atherosclerosis can be reversed by a low-fat, plant-based diet. That's the only diet that does that. Now, I know that this guy, this Carvalho, who, sort of is trying to say that oils aren't that bad and animal foods aren't that bad, is trying to say, well, some patients improve if you feed them as much as 20 to 30% fat. But why do something that is sort of half-assed and may or may not work when you've got something guaranteed that works? Okay? Atherosclerosis has been around for a long time. Atherosclerosis occurred in the ancient mummies, and that's been shown when you can do CAT scans. You'll see them have calcifications in the arteries of their hearts and their aortas. They got lesions in their hearts and in their aortas, the calcified vessels. It occurred in European aristocrats who ate diets that were rich in meats and cheeses. It occurs in any population that eats high-fat diets, in Alaskan Eskimos who eat something similar to the Atkins diet. They've been doing that for like around 500 years. They've got lots of atherosclerosis and lots of osteoporosis. We talked about that before, how you get more sulfur-containing amino acids in the meats, and that leads to, in part, degradation of sulfuric acid in the blood, metabolic acidosis. The kidney excretes the hydrogen proton simultaneously while it excretes calcium, and it leaches some of that calcium from the bone, leading to osteoporosis. So here's one paper on the bone mineral content of Alaskan Eskimos. Okay, the Atkins diet can get a person to lose weight, but it makes them sick. Even his own data, Atkins, showed that over 70% of his patients were constipated. That's the other joke about the Atkins diet. In the short run, you can lose weight on any diet, but in the long run, it's not very sustainable, and the only good thing about it is you save money on toilet paper because you're constipated. It's a bad idea. They often have bad breath, ketosis. As atherosclerotic plaques get older, they often calcify, and the calcifications can be seen on a CAT scan of the heart. Calcification is an end stage of inflammation anywhere in the body when cells are dead, and when a person has inflammation, calcifications elsewhere in the body, the immune system typically will heal it, and then it'll scour over that area and with or without a calcification. Dr. Mcdougall says, I actually had a CAT scan on my chest and had some coronary artery calcifications, likely from his younger years when he ate the SAD diet and smoked cigarettes. But those are just old scars. They don't do anything. Those are not unstable plaques. I do not have any angina. I just eat the proper diet and don't bother with those coronary artery calcifications. So that's smart, right? They're not active lesions like in the sense of a soft plaque. And like the small plaques you can't even see are the ones most likely to rupture and occlude a coronary artery. So anyways, the big point made here is the smart way to go is low-fat, low-sodium vegan diet with no oils like the Esselstyn diet for preventing coronary artery disease. And you're kidding yourself if you think you're going to optimize your health with surgery or medications for coronary artery disease. I hope that was helpful.